a lot. I'll be hanging out in the background. And do know at the end of the session, you are able to use this for your one shadowing hour by attending this if you are applying to Rush. So stay tuned for details.
Awesome. Thank you, Bridget. I'll go ahead and take over just for a quick sec and introduce myself. My name is Daniela Ugalde. As Bridget said, I'm an admissions committee alumni member. I graduated with the class of 2024. And honestly, the way that this first started with the Alumni Q and A's is when I started back in 2021, I was reflecting a lot on my experience as a first gen student applying to grad school. If you guys remember a little something like COVID happened and during that time. So it was a little bit difficult at that time to get shadowing hours, networking opportunities, getting into clinics in different places, right? But what helped me learn more about the field and learn more about other clinical experiences was actually connecting via Facebook with other clinicians. And what was helpful for me is we kind of just jumped on Zoom calls, FaceTime calls like this, and I got to ask them some general questions about YOT, what they enjoyed, and the impact that it made in their lives. And it was honestly a wonderful experience for me. So when I came to Rush and then finished my time there, I thought, what a wonderful way to create a better community, a closer community of not only alumni, but current students and prospective students too, so that we can all be better connected to the world of OT and kind of bond about some experiences, but also learn a lot more about the field. So yeah, with that, I will be helping facilitate some of our discussions today. So I will let Annika introduce herself. She will be also helping me facilitate some of the discussions as she's a more recent alum than I am, and help me answer some questions. But then we also have two other alumni members, Taylor and Olivia, who will be sharing a little bit about their experiences, not only in acute inpatient rehab, but all the wonderful things they have to share as well. So I'll turn it over to Annika just to introduce herself. And
Yeah.
yeah,
Hi guys. So like Daniela said, my name's Annika. I am a recent graduate. I just graduated in May from Rush, and so just finished taking my board exam and don't start work for a little bit, and so was happy to hop on and give a more recent perspective from the Rush community, as well as listen to Taylor and Olivia and their wonderful lives as OTs. So I think Taylor was a TA of mine my first year, so it's so wonderful to see. Um, how much she's doing now, but I'll pass it over to them for them to share a little bit about themselves.
yeah, Taylor, Olivia, if you guys want to share your name, your pronouns, when you guys graduated, and then just the current settings and places you're working now.
Yeah, I'll hop in. My name's Taylor, she, her. I graduated with Daniela in 2024. And for the past 2 years, I've been working in acute inpatient rehab, the same hospital, Alexian Brothers Rehab Hospital out in like Elk Grove. So that was kind of my desired setting. One of my two 12-week field works was in inpatient rehab. I was always really interested in the physical disability setting. So I primarily work with the adult population. It's a not specific rehab. So our units see a variety of neurological, orthopedic, cardio, respiratory, amputees, the whole thing. So
Awesome.
Hi everyone, my name is Olivia. I am also a graduate from Rush from the class of 2024. So nice to see Taylor and Daniela again. So since graduating, I've had quite a few different positions here and there. My first year out of grad school, I decided to kind of test the waters and try a couple different things. So I took a couple different PRN roles, which for those that don't know what PRN is, it's per diem, so kind of working as needed. So it's neither full-time nor part-time. It's just however many hours you're agreed upon with your employer. So I worked a little bit of PRN in a memory care facility, just mainly doing evaluations and progress notes. And then I worked PRN at Marion Joy Rehabilitation Hospital in Wheaton for about a year and a half. So that's also inpatient rehab, just like Taylor works. And then I also PRN'd a little bit in home health. And then since that, I've also now had a full-time position with Fox Rehabilitation for about a year. So that's primarily like an outpatient geriatric setting. So I work within senior living communities, which consist of assisted living, independent living, and memory care. And I do some house calls as well. So even though it's just been 2 years, quite a few different places I've been. So if you have any questions about any specifics on those things, just feel free to ask.
Awesome. Thank you both for your wonderful introduction. I think what we'll go ahead and do is I'll just ask you kind of a basic question about maybe what your day-to-day looks like. And then afterwards, I will open it up to the rest of the group. What you guys can go ahead and do after they answer that question is you can either type in the chat and I'll read your question aloud. You can message me privately if you would like, or you can go ahead and unmute afterwards. But just to kind of get some feelers about what your day might look like, can you tell me a little bit more about maybe what your day-to-day looks like? What are some things that you really enjoy about it? What are some things that you're continuously learning?
Yeah, so my day to day, it might be different for kind of different rehab hospitals when people start. But my schedule is 7 to 2:30 is kind of those main hours. So typically, most of us get there about 30 minutes before, so we can eat breakfast, but also print out our schedules for the day, and using that time to kind of chart review any evaluations we have or patients on our schedule we're not familiar with, just kind of get prepped for the day. And then the way that our hospital works is typically our first two sessions of the day are an ADL or a self-care session. So those would be 60 or 90 minutes. And we're obviously just focusing on having that patient perform their self-care tasks as independently as possible. So that can be as full as like showering, getting dressed. We're introducing adaptive equipment or different DME, different strategies that they need to work on. And then the next 3-ish sessions until lunchtime are treatment sessions. So those would be out in the gym with all the physical therapists doing regular kind of treatment intervention type things, focused on whatever their other goals are. That could be, walking and mobility, cognitive skills, strength, coordination, a combination of everything. So my first 5 hours of the day are treating, then we have an hour lunch, and then the last hour and a half of the day are also treating. It feels like it's pretty fast paced back to back, but it makes the day go by fast. It keeps you on your feet. And then I believe we have like a built-in 30 minutes at the end that is also for documentation to finish up our notes. We're encouraged to do point of service, which means that we're kind of documenting as we're treating, which I would have to do or I would forget everything. And then our lunch is just an hour lunch that we're documenting in. Often we'll have like monthly meetings with the whole therapy team once a month, or we'll have OT specific meetings to go over different things that we're implementing. And then also throughout the day, part of your schedule could be marked off to be part of a team conference, where you'd be representing OT with a discipline, a representative from the other disciplines, care manager, nurse, doctor, to discuss updates for the patients, discharge planning, giving just our recommendations and things like that. I'll stop there and let Olivia go.
So my days look a little bit different than Taylor's, but also a little similar. So I don't have as structured of a schedule as she does. I make my own schedule. So I have a caseload of patients each week. And I get to schedule them whenever I want to. So working within the senior living communities, all the folks live there. So unless they have any outings or they have doctor's appointments and stuff, they're typically pretty available. So I make appointments based on, kind of what we want to work on. So similarly to Taylor, if I have a patient that I want to do like a self-care session within their apartment, if you want to work on dressing or bathing, I'll do an earlier session, like a 7 or 8 a.m. or sometimes 9 or 10 if that's when they get up. And then working through the day, I'll take folks out to the therapy gym, doing, exercise or activities. Because I'm working within the communities where people live, I'm working a lot also on just like community mobility, taking people out, making sure that, if their goals are related to, walking to the dining room, then we work on that within our session. So I kind of plan my sessions around patient goals. And right now I travel between 2 facilities. So I do have to kind of build in a little bit of time for travel in between, but It's super flexible. I get to kind of take my lunch whenever I want to. And that is one thing I always make sure I at least take a lunch, because you can kind of get caught up doing sessions back to back. I always make sure I at least build in about a half hour for lunch. And then Monday mornings, I typically run an exercise class in the memory care unit. And then once or twice a month, depending on the need, I'll do an in-service for some of the staff and for the residents based on whatever topics they kind of want to talk about. But overall, a little bit of a less structure than like a typical inpatient rehab facility, because I don't have set hours. I kind of just make my own hours depending on, when patients are available, or sometimes I can make my days a little bit longer. If I, Mondays and Tuesdays, if I stack them and see more people, then I can have shorter work days on Thursday and Friday. So again, just super fluid and flexible, and kind of up to me and my residents and patients and their availability. So.
Awesome. Thanks for both sharing your experiences, and again, just how kind of versatile OT is, especially in again, you could be in somewhat similar settings, but also have very different outlooks of what the day could look like. So thank you. At this point, because I'm sure you guys have lots of questions for them, I'm going to open it up to you guys. So if you guys have any questions, you can go ahead and throw it in the chat, and I'm happy to read it out loud. Or if you want to just unmute and we can just have a discussion, that would be wonderful too.
I was wondering, when you guys were going into OT school, what kind of setting did you want to be in, and how did the program, help you get into that setting or change your thoughts on different settings?
I can speak on this first. I was pretty open going into OT school. I didn't really have a specific setting in mind. I just knew I didn't want to do pediatrics, which I still kept a pretty open mind about it. But I knew I wanted to at least work with adults or geriatric population. And I really feel like the fieldwork opportunities that were offered through Rush were incredible. There were so many different settings to choose from, again, being somebody who was kind of open to anything, going through the list of field works, you had so many different things you could choose from to explore. And then on top of it, I think, being connected to the hospital, doing practicums where you're able to shadow OTs your first year, you're just really getting exposed to a lot of stuff right off the bat. So just a lot of things to see, not just the classes, but things outside of classes as well.
Yeah, and just to go a different direction, just for more ideas, I didn't come in closed-minded. I just kind of had a good idea of what I thought I liked and what I thought was, most suited for me, which was more of a physical disability setting, whether that was acute or inpatient rehab. I also more wanted to work with adults, not love kids. I wasn't thinking that was gonna be my day to day. So even though I kind of knew that I wanted to do that, I do feel like obviously the program, you get a course on every single setting, every single population. You get very well versed in it. So, obviously you can always, we're trained to work with any type of population, but I think it was nice to have classes on everything, because you could kind of get an idea of what you're learning. I definitely found myself leaning towards those classes and enjoying them a little bit more, which kind of confirmed that. But you kind of get the opportunity to kind of picture yourself in all the different settings as you're learning about them all and having to do hands-on experiences with all of the settings. We're making splints, which is more of an outpatient hand population. So I don't do that day to day now, but I got the opportunity to practice that if that were to be the path that I took. So yeah, I think just the variety of classes does help you kind of find your way a little bit as you kind of see which ones you're more drawn to.
Great. I have a question in the chat that says, what other areas can you explore in OT besides rehab, peds, and ortho?
Mental health saying mental health sounds so general and all encompassing, but it's definitely, I feel like, a bigger focus. And I know that within the program, one of our professors, Ricky, has really tried to revamp and update those courses. I did a field work at an outpatient mental health setting that it was a little bit more similar to the structure of Olivia's day to day, where you're out in the community, you're making your own schedule, you're meeting people where they're at and kind of in the timings that work for them. So um, I was working with individuals that were living either independently or in a what's called specialized residential mental health facility, essentially like more of individuals that didn't have other social supports and they would potentially be unhoused if they weren't kind of living in this kind of community. And we were taking them out into the community to practice things like community mobility, taking the train, money management, and also the goal was to prepare them for independent living. So then I was also working with individuals that were living independently, and we were practicing grocery shopping and cooking and kind of making healthier choices. But all those individuals did have some sort of mental health diagnoses that kind of qualified them to be a part of that program. So it was super different, a really different experience, but it was, OT kind of has a place everywhere. And that's one that is a little more niche, but definitely has an important role as well as inpatient psych.
Yeah, just to touch base on that a little bit, I also, similarly to Taylor, I had a field work in inpatient psychiatry. That was my level 2 field work. So definitely mental health is a huge field in OT where you can work. And I know that it looks like the question specifically is asking like what areas you can explore. I think that's really where like capstone comes into place because working and exploring is two different things. With capstone, you can be as creative and really go whichever route you want to go. I had my capstone placement at Lincoln Park Zoo where I was running like wellness groups and stuff for staff. So I think that's kind of the beauty of OT is you can really take it and put it anywhere and explore that area within OT. And I think that capstone is really where that kind of shines through, where you can really explore those unique and niche areas.
Yeah, there's definitely a lot. I mean, personally, like I was at a low vision eye clinic for one of my field works. So definitely a lot of niche areas to explore, not only through field work, but through capstone, which is exciting. I have another question in the chat that says, what's the difference between a doctorate of occupational therapy degree and a master's? Would your career look a little different? They would just like some just general insight.
I think yes and no. I'm going to only answer the part of that I feel like I can answer, but um, I know kind of one of the biggest differences between the master's and the doctorate is having the ability, or like part of our doctorate degree incorporates more like professional development and opportunities to like teach and things like that. So like I have a friend at work right now that's been working for 3 years. She got her master's, but she kind of is wanting to get more into teaching and she wants to be an OT professor. And that just isn't, I think you need to have more of that doctorate level degree to teach is my understanding. So she's going back and doing like a PhD right now because she wants to kind of be more in like the academic space within OT. That was always kind of like the big difference in my mind. And also the doctorate gives us, it's like a requirement to be part of a lot more like research in OT. So like research projects with our professors and more, professional development. And I'm trying to think of a grant writing, things of that nature. Were a little bit more part of the doctorate program than the master's.
Yeah, I think you hit the nail on the head, Taylor, actually. I think the focus on the doctorate degree, right? It's a little bit difficult for us to speak about maybe what the master's program looked like at some point, just obviously because we didn't go through it. But those are some of the main differences I would highlight too, is just that professional development piece of going back and wanting to be in academia in some sort of way, whether that's teaching, whether that's research based. Or again, a lot of focus on like program development too, right? So looking back and like seeing, hey, if you want to develop a program from the startup, how are we doing that assessment? What people do we need to be connected to? And kind of just looking at the larger scope. In terms of like how your career could look a little bit different, I think there's a lot of variances based on like the different settings that you're in. For example, again, different than our alumni, but I'm in the school setting. So for me, the way I get paid is different, slightly because I do have the doctorate degree versus the master's degree, right? So that can differ sometimes in compensation, and it can differ sometimes too in just experience, but it can look different in different settings. So not to say that, just saying that they're kind of a little slightly different, but generally what you're getting is kind of the same core curriculum, and getting some of those basic skills. Okay. Next they were wondering, what is a day-to-day schedule like for a student at Rush? How did that look for you guys?
I don't know if Annika wants to
I
answer
can
because it was more recent, but
briefly.
go for it,
Taylor, you
Olivia.
can go. Okay. I just briefly I'm sure Taylor and I probably have different experiences too, because I think Taylor, you probably lived a little bit closer to campus than I did. I was a commuter from the suburbs, so that was a huge factor in what my day looked like. Um, you know, it being 2 years out, maybe Annika, you can kind of jump into to fill in some of what I'm forgetting. But when you're on campus for classes, I want to say typically classes don't start until around 9 or 10, and you are typically going until lunchtime. You break for lunch, then you have an afternoon class. So as a commuter, making time to make sure I get to campus, factoring traffic in and stuff. There is built-in lab times too, like your first year for anatomy, you're spending a lot of time in the labs in the afternoon. Um, but again, I mean, your schedule varies so much from semester to semester. It's kind of hard to. Oh, someone just popped something in the chat. I think Michelle did. It's kind of hard to, break it down specifically day by day, but you are spending time on campus with everybody else the entire time. So, kind of going through the day with everyone else.
Yeah, you guys kind of, it hasn't changed very much. I'd say very similarly, most days you have two classes a day, a morning class and an afternoon class. Mostly like 9 to 9 or 10, and then you're done at like 3 or 4-ish every day. It varies based on semester too. We are a full-time program, so you will be having classes or fieldwork rotations in the summer, which is different than some other programs. But we do have the luxury of it always may vary. So if it doesn't happen next year, don't hate me. But we do have the luxury of not having class on Fridays as an opportunity for more students to work outside of classroom time together, as well as have opportunities for practicum placements. But it is a nice little break during the week as well.
And I would say just like a note, because obviously those classes are a little bit longer. I don't think anything was probably much shorter than like an hour and a half. They're a bit of a longer course, but I feel like in pretty much every single class, you're going to be getting out of your chair, doing something up on your feet. Even if it's not a lab class, we're doing lots of like hands-on practice things with each other. And as the program goes on, you're more and more active doing hands-on things and assessments and things with each other. So it definitely, there's certain classes that you're taking a little more notes and you're having to, watch slides and more content heavy. But I think in general, it always feels very interactive, which always, makes it more interesting.
Yeah, that's what I was about to say. I was like, there's a lot of like hands-on learning. Like, yes, there are some definitely times where it's appropriate for more of like a traditional classroom, but I think that's probably what I enjoyed most about my experience at Rush is like, okay, sure, we're doing a semester where it's a lot in classroom, but then we have a field work, right? And so we get to go out in the community for 2 weeks and go into a different setting, or we do a practicum throughout, right? So, for about a month, like once a week, we'd go into a setting with another buddy and we'd get to go with a clinician, right? And they would like show us around what's the hospital like. We were at the preschool at one point, right? So there's a lot of like your schedule changes and shifts quite a bit, but it's kind of nice, especially if you're that kind of brain that's like, I need something different, like what's new, like let's change it up a bit. And I find that a lot of OTs are kind of naturally in that mindset too of like, I love a good schedule routine, but like what else is there? So I think like having that flexibility too, is exciting and a very much part of your day as a Rush student. Okay, our next question says, what have you loved most about the Rush program?
I think the community, which I know sounds so corny, but not only just like our own cohorts, obviously, as you can, sounds like we spend every day together in all of our classes, throughout the whole week. But I think our wonderful faculty and professors really treated us, even as students, like as colleagues. Um, and so even, it's our first year, we're getting paired with professors and they're including us into research projects and things like that. And then obviously beyond, we're kind of, the alumni are in constant communication, getting emails about job opportunities and involvement in things like this. And, we're going out and presenting at conferences for research that we've been a part of together. So I think just the kind of built-in community of being someone that went to Rush, like I just feel very lucky that I have, whether it's professors to reach out to or just all these built-in opportunities from the program that I felt like, got me the opportunity to present at a conference and get the research that I was a part of published. So those were things that I feel like I would never have had a chance to put on my resume, because I probably wouldn't have like sought out research opportunities. So I think it just really, I felt like it made me feel like I was set apart, just with all of that extra built in stuff. Yeah.
Yeah, I mean, I've made so many lifelong friends from Rush too. Like I still stay connected to a lot of the people from my cohort and not only just as friends, but also, obviously as OT clinicians, if I have questions or, you know, so you have people you can relate to at the end of the day. When you've had a long day, you can text people you've been in school with. And then on top of what Taylor said, also, I think Rush as a program stands out because you're so connected to the hospital. You're really immersed in that healthcare setting from day one. You're seeing other students from other programs at Rush. You're seeing, hospital workers. You're seeing patients. So you're just so immersed in healthcare just from the get go that I feel like it really puts you in that mindset. And I feel like that was part of what kind of built like me not just as a clinician but as a professional as well, is just kind of being so immersed in all of that.
Wonderful. Thank you, guys. Next question is, how long did it take you all to land your jobs after school?
That's a good question. Everyone kind of chooses their pace of how long they feel like they want to study and prepare for their boards before they take them. I feel like some people, are jumping into that kind of towards the end of their capstone because they want to take it as soon as possible and start working. Um, I believe we graduate in April, right? Or May, April? Graduate in April. I chose to kind of take the boards in June. I wanted to give myself the time to study. So I studied for about 2 months. I took it in June. And then kind of around that June time as I was taking it, I was kind of applying. So I believe I started my job in August after graduating in April. I believe I got it in July. I think I just wanted to definitely make sure I passed before I got a job, even though a lot of jobs you can start before you have before your boards are completed. A lot of them, they will hire you and you'll start working, and it's just kind of pending, that you'll show that you pass when you're signed up to take it. So I think everyone definitely chooses their pace. But yeah, personally for me, graduated in April, started working in August.
Yeah, I had a similar experience too, being in the same cohort as Taylor. I think I took my exam sometime beginning of June, and then that for me, once I took my exam, that's kind of when I started applying for jobs. So then I could kind of let them know, like, hey, I took my exam. I'll be getting my results back soon. And I remember I applied to two PRN positions. I actually got both of those jobs before my results even came in for the boards. And then I onboarded at one of my jobs in August, and then the other job, like as soon as my license came in, they had me in the door. So that was like middle of July. So like as quick as you want, pretty much is the answer. Is what it sounds like from Taylor and I.
Yeah,
I
and
think just
I'll,
for context, I was gonna say, I think like the earliest person that I was aware of, like maybe started working in like June. Like, but again, that would be, they graduated in April, took it in May, started working in June. Mm, I think Rush really sets us out to like stand out and to be really competitive in the job market. So I honestly think it more just depends on kind of what your timeline is kind of for when you want to start.
yeah, and there are definitely a lot of jobs out there, and it definitely depends on like what you want to get into too. Like I do something very different. I'm a school-based OT. So I was interviewing for jobs probably in March, April while I was out in Capstone. And then got my first job I was hired on in May, but obviously school systems don't start until August. So again, there's a lot of variability too, and like just depends what you're looking for. But yeah, different timeline for everyone for sure. Our next question is, do you guys collaborate with other health professionals in your jobs? What does that look like? And also, did you get to collaborate at all when you were in the hospital during school?
I think that is like honestly one of my favorite parts of my job. I hope I don't annoy the other therapists, but I love going to like the PT and the speech therapists that so we all, are assigned as a primary therapist. So we try and keep it consistent with our patients. And we're with them for 1 to 4 weeks in rehab. So we get to know them very well and we're watching them in the gym with other therapists. So I am constantly kind of checking in with the PT or the speech therapist to make sure like what I'm seeing is what they're seeing, our long-term goals on the same page. We're obviously want to make sure our recommendations line up. If they've met the family and I haven't met the family, what were they like? So definitely with the therapy team. And then the care managers are a huge role because they're the ones communicating with the family. So they're constantly giving us updates on, the length of stay and if their insurance is going to cover this type of outpatient therapy. So um, I think everywhere would be super encouraged, but I think that's just where I work specifically. I feel like we're really great at that. So I love it. And then at Rush, I know we overlapped, I believe with nursing students, we were in like a combined like training. I think we were like taking blood pressure. I think there were some things that if there's an overlap, they kind of just would bring us together. So I definitely thought that was cool. I think that was, I only remember it with nursing students, um, unless I'm missing it.
I'll quickly butt in before. So we have like our IPE courses, which happen your first year. You are on like a team with other first year students. So that's anyone like in the health systems management, medical students, speech students. Every looks different. You're kind of randomly assigned, and so you do have to meet with them. Um, it's online, virtually. I think it's twice a semester, but then you're responding to like weekly posts and getting to know your team on your own schedule throughout your first year. And then additionally, now we do a simulation lab as well with speech students. So you go into a room with a standardized patient together, and they do an assessment, we do an assessment, and then we go into like a break room afterwards and kind of come up with the best discharge plan for them. So that's just another opportunity to work on your skills at one, advocating for OT, but then also looking at other disciplines and kind of coming together to a consensus on what's best for our client as we look at discharging them. So I know that's another way that they've integrated that, and I know they're always looking for other ways to do so.
Wonderful. On the topic of NBCOT, how long did it take to study for the NBCOT exam, and how did Rush prepare for you to take it? And Annika, you got to jump in at some point because you're fresh.
Yeah, so I just took mine at the beginning of June, and I studied for 4 weeks before that. I know they recommend between 4 and 8 weeks, and honestly, I just kind of needed a break after graduation, so didn't start right away. Um, but they do a very good job at preparing you. You have a course the first or the summer of before you graduate that kind of takes you through the MBCOT and how questions are structured and all of that. And at the end of that course, you have to take a practice exam. So that just helps you understand how the exam is structured and also gives you areas for you to know that you want to keep studying on. I'd say a lot of my classmates then kind of forgot about the MBCOT and went on field work and studied that way. And then when capstone started again in the winter time, people, I know some people started studying slowly throughout capstone. Others preferred to wait more towards the end and start an 8-week program. Some preferred to wait till graduation was over. But I'd say a majority of my classmates are taking it or have taken it end of May to end of June. They really recommend you taking it as soon after as graduation while the information's fresh in your brain. But I felt very confident going into it, passed, and I know a lot of my classmates have passed. Rush definitely does a very good job at preparing you for the questions. Like the questions you'll get on exams in class are similar to the style that the MBCOT writes, so that's helpful as well.
I also, my capstone, I was kind of a little bit intertwined with Rush administration. So myself and another student, I hope it's still out there. We, for whatever reason, we kind of got tasked with creating some different like MBCOT study guides that were in like a shared drive for Rush students. So there's different like books that the staff will, the faculty will recommend for like you to purchase for studying from. And then, oh, good. And then, yeah, we created like a 4-week study plan and an 8-week study plan that, broke it down between all of the different settings and topics and, pages that you should do and different note cards and study packs. Everything out there exists, like online flashcards and the books and everything. So it sounds like that still exists. So that would be, they try to definitely give you also as many resources and things from previous students that should help.
And they do a very good job too. I've heard of like individuals who don't pass, they will like reach out to you, even though you're technically not their student anymore. They will guide you through that process if that is what ends up being you. So just because you graduate doesn't mean you're kind of all on your own.
Okay, our next question is, can you explain, I guess, a little bit more of the exam and then the licensing process after graduation? And then there's a more specific question, if an OT has to move to another state for their job, how does that affect licensing process? I'll just touch on that really quickly and then I'll let you guys answer the rest. Um, so with licensing, again, like it could be very dependent. It can be dependent too if you're going to do travel OT or not, because a lot of those agencies will help you get the specific license that you need for whatever state you're traveling to. Every state has kind of their own set of requirements as to what the processing fee may be, especially and if there's anything additional that you may need. So it's a little bit variable in that sense. So I wouldn't be able to tell you what it looks like for each state. However, something to note is that some states do have like an OT licensure compact. So depending on where you get like your first license, you may be able to use that same license at another state. So just something to look at. I don't know the very specifics of that, but just something to kind of answer that. Any experiences with after the exam, the licensing process that you guys remember, Taylor and Olivia?
I remember being quoted that it was going to take like 2 months, but it ended up coming in like 4 weeks. So, in my personal experience, it was a lot faster than expected. I know that with a lot of people taking the exam around the same time, I think there is a little bit of backup that happens, but um, I don't recall me or anyone else that I spoke to having any issues about having to wait super long for it. It was pretty quick. And it was really nice to kind of have a couple weeks where like you pass the exam, you're just kind of waiting on your license and you just kind of have time to just chill and relax and enjoy the summer after, a couple years of grad school. So
Yeah, I do know, I don't remember much, but I do know that we got like extensive PowerPoints and packets and step-by-step details from the faculty on like how to go about that process, websites, what to click, how to go through it. And I think, like I said before, like most, if you do have a job, you don't have your certification, like I think I didn't have mine, but I like sent them a screenshot of like that I had passed my score, all the stuff. And a lot of them are like, if they hired you, they're needing someone to work, they're like very willing most of the time, depending to, kind of let you start pending that coming through.
Exactly. And like Taylor was saying, like there's always like temporary license and permits that you can file for as well. So if you are like, hey, I want to start work immediately, right? And you're in that limbo, which happened to me for a hot sec because I wanted to work like a summer school. That's definitely another route that you can go to. And again, what's nice is all you have to do is when you fill out all your paperwork is tell NBCOT, I want you to send my scores to the Illinois Department of Federal Regulation, right? And so they'll communicate in that way too. Good question. Um, Someone said, where did you complete some of your clinical sites at?
My first two fieldworks, which are our level one fieldworks, which are all 2 weeks. They tend to be a little bit less intimidating settings, at least for mine it was, which was nice. My first one was more of a community-based setting called Midwest Brain Injury Clubhouse. So that's a little bit more of like that niche kind of community setting where you might not know that OT exists, but essentially it was like a day program for individuals that had a history of some sort of traumatic brain injury. So kind of family members would drop them off in the morning. We would kind of spend the morning having them participate in games and activities. Some of them were a little more educational related, some were just fun. They would all bring their lunches and then kind of more structured activity and games in the afternoon, and then they'd get picked up. So uh, that's kind of a more community based option. My second one was in acute care at University of Chicago. My then my two level twos that are the 12-week experiences. I was at McNeil Hospital, which was an inpatient rehab setting in Berwyn, Illinois. And then my second one was the kind of community mental health one that I mentioned that was called Trilogy Behavioral Health in Chicago.
My first level one field work, me and a couple classmates decided to do a field work out of state. So we all went to Baltimore, Maryland, and we did our level two field work at Johns Hopkins, which is probably one of my favorite memories from Rush, is kind of going there for the couple weeks. And then my second level one was in outpatient neuro. And then my first level two was at Marion Joy, which is inpatient rehab. And then my last level two was in inpatient psychiatry at Rush.
Awesome. This one asked, have you guys ever considered pursuing a CHT certification or a pelvic floor? And I'll just open it up to any sort of certification beyond what we have. If so, why or why not?
I haven't considered pursuing either of those two, but my company does do like an LSVT big certification, which is specifically for working and treating Parkinson's patients. So that's something that I'm interested in doing this fall, hopefully. And then potentially also my company offers like lymphedema certification. So I'm looking into potentially doing that as well. So those were the two.
Yeah, I would say those the certifications may kind of match where you're working. So I do have a friend that's in outpatient hands at Rush Ortho, and so she is now kind of starting her studying in preparation for the CHT exam. I believe you have to work for like 3 years before you can sit for that. So that is very specific to outpatient hands. So I'm not doing that one, but I also I feel like in rehab, I'm just kind of looking for any certifications that would give me more experience and kind of extra specialty knowledge just to make myself more valuable as a clinician. So I also have been interested in something lymphedema related. Um, not at my rehab hospital, but where I did a field work, we did have one of the OTs that was like their more specialized person related to burn victims, I guess. And there are lots of more like general certifications that are specific for like different neuro conditions and things like that. Um, but I would say like maybe depending on what setting you're in, you might kind of be looking at different certifications.
Absolutely. And just to highlight a few things, I saw Michelle dropped in a fieldwork flyer if you guys are curious a little bit more about fieldwork and maybe some different sites. And then Michelle also dropped some certifications that you get during our Rush program, which are actually quite a few, which are really nice because some of these certifications you would have to pay a significant amount of money to get them as a clinician instead of a student. So, yeah, just some things to consider. Okay. It said, next question is, how soon can you choose a specialty for OT, or does Rush help you with that? And would that be something you do after you graduate?
I would say technically, well, you can decide whenever, but I would say as graduating with an OT doctorate degree, we are trained to technically work at any of those settings, whether it's pediatrics, hands, outpatient, acute care. Um, I know that like I think that I would say that like the more settings that are kind of coined as like specialty areas are maybe like within the scope of pediatrics. There are OTs that work in like the NICU, and a job like that, you would need to have like more experience in like a pediatric acute setting before you would get that role. Um, but I think in general, in order to get like a job as an OT, you don't have to have a specialty. I think a lot of us just kind of pick the setting and the population that we're most interested in. And I would say most of these kind of general settings that were talked about, you can just apply with your OT degree and you don't really need anything beyond that unless you have like a very specific population. Like I said, like I don't know, the NICU is all I can think of right now. Or like kind of like we are saying, the lymphedema certification, there's certain things like that you would need more like certifications or experience with. But yeah, I don't know if that makes sense.
Yeah, I was also going to say, I think this is where field work plays a huge role. I always encourage students to, when you get to the point where you're choosing your field works and there is something that you're interested in, but you're not quite sure, like just go for it. Field work is a place to try new things and see what you like and what you don't like. Because especially the level ones, I mean, those are 2 weeks. So really you can try anything at that point, but using the field works to really see and feel out kind of areas that you maybe think you might be interested in pursuing after grad school. And I do think Rush specifically offers like a huge variety of fieldwork settings that I think makes them really unique and stand out, as you have so many different areas to choose from. It isn't just, pediatrics and phys dis. There are a lot of really niche settings.
Absolutely. I want to highlight really quickly, Bridget just shared an alumni shadowing pairing Google form that you guys can sign up for. So if you guys are interested in potentially shadowing alumni, we have a variety that are really interested and love having students. So if you're interested, you can go ahead and click on that form. And we have about maybe 10-ish minutes left. So if anyone wants to put some last minute questions in the chat. I just want to say really quickly too, like I've really appreciated the discussion we've had. I feel like we've touched on a variety of different topics and you guys have some really insightful questions and some good ideas. So thank you. I guess for like one being so open to the opportunity and being flexible and having these curiosities. We love to share them clearly.
Guess I'll ask them a question if no one else has one. But I think one of the beautiful things of OT is how holistic we are. So both of you guys being in more like a phys dis setting, how do you find yourself incorporating kind of that whole body holistic care rather than just the physical disability care?
Yeah, that's a great question. Um, like ironically enough, I one of my last sessions of the day today, I felt like I was just sitting and talking to my patient for about 45 minutes of it. And in my head, I'm like, how is that productive? Like that's we're not doing anything. But then I also know like we pretty much spent the 45 minutes talking about his discharge plan, and he was really anxious about going home. And we were just going over kind of what things the caregiver he would benefit from help with, and different equipment and strategies and things like that. So I think I love to personally do is we're getting closer to like a patient's discharge. We're like looking at the bigger picture, not just like, can you put your pants and your socks on and walk across the room? We have an ADL apartment that I love to use. We have one at Rush too, and I think I probably didn't realize how much I would live in it with patients because I'm bringing them down there and I'm making them move clothes in and out of the laundry, carry it, with a walker tray into the room so they can hang it up. And um, I think that is like a big transition I see with a lot of patients when they start to kind of make that step to doing a little bit more like functional tasks. It feels like it just naturally is a little bit more holistic because at that point we're not really focusing as much on just strictly the physical. It's a little bit more of like their readiness and their confidence and things like that.
Yeah, I think, again, the beauty of OT and why I kind of fell in love with it is it in its nature is pretty holistic. So you can use that phys disc component kind of as a backbone, but you want to treat the person as a whole. So in my setting, a lot of my folks, they're retired, they're a little bit older. So helping them age a little bit better, making your sessions patient-centered when you're doing evaluations, really making sure that you're asking questions on what they want to work on. Whether maybe they don't want to put their pants on, maybe that's not one of their goals. Maybe they want to be able to get their TV remote by themselves, just making sure that when you're working with folks, it's not just the phys dis and just those aspects that you kind of learn in those phys dis courses, but also just kind of you're treating the person as a whole, and what they want to work on should be incorporated into your sessions and your goal areas too.
Absolutely. That's a great point. Okay. And our next question, what made you choose OT as a profession?
Um, I I don't really I feel like a lot of people maybe come in with like some tie to healthcare and OT experience themselves. I just kind of stumbled into it towards the end of college. I didn't go straight in to grad school after college because I was just still kind of like exploring different areas of healthcare because I didn't really know where I wanted to go. But I had an opportunity to do like an internship, but I was pretty much just shadowing and kind of helping out in a rehab facility, shadowing occupational, physical, and speech therapy. So kind of looking at all three, kind of seeing what I liked the best. And it really just came down to like how creative and fun the sessions looked. It seems like, the therapists, we can incorporate like games and activities and real life activities in a functional and fun way and kind of sneak the therapy in there, even if they don't realize they're doing it. So it felt like it was a really great area that you can obviously make a lot of progress and make an impact on your patient, but in like a fun and creative way that obviously, of course, the goal is for them to enjoy it to some extent, hopefully.
Yeah, I don't have, some crazy story where I had a revelation on what I wanted to do. I just kind of knew I wanted to do healthcare, and through research and shadowing and stuff, I really kind of going off the last question, actually, just how holistic and functional OT is. It's so collaborative, and kind of, you guys had some great questions throughout the last hour. Like, there are so many settings you can work in. You're not only creative in the setting that you can work, but you can expand to so many places. You can work in schools, you can work in phys, you can work in communities. It really, you can take OT anywhere you want, and I think that's really the beauty of it all. It really is what you make it.
Wonderful. Well, I was going to say, if anyone has some last minute questions, go ahead and throw those in the chat. But I thought that was a really nice question to end off on. I think we can say, or I don't mean to speak for you guys as alumni, but oftentimes, right, you're so deep into the practice, and it's really nice to just kind of reflect on, why OT and why this is so meaningful. So thank you guys for your thoughtful reflections. It makes me happy. And then, okay, our last question, if there was any advice regarding applications and how to stand out, what would you give to a prospective student?
That's an intimidating question. I feel like I would say I don't remember like too much about the applications, but more about all of the interviews because I feel like most programs, the bigger, no, it's so scary. It's so scary. And I feel like, the applications, obviously, you are required for most to have some level of, observation, but, it could be nice. Let's say I worked as like a therapy tech before, any little bits of probably extra experience is nice. But I think, um, I know I was kind of the most nervous for the interviews because that's when you're really putting a face to your application and, trying to stand out because a lot of them are group interviews. So um, I would say definitely going into those interview portions prepared, which of course you will, but um, there's very easy to find online like common questions that are asked and things like that. And I think just maybe coming in with a nice perspective on, why OT and what you feel like would make you a good clinician or a good part of a cohort. Um, so I think that maybe that's where to focus on, but it's scary and I don't know how to make it less scary.
Yeah, I was just going to say, I think you guys are already a step ahead just attending sessions like this, coming and learning about Rush. And, that's things that you can also speak on in the interviews is some of these things that you join in on, follow Rush on social media, just really kind of get to know the school that you want to go to, get some background because I think when you come in with a little bit of that insider knowledge, I think it really does shine through in the interviews, like Taylor said.
Yeah, I completely agree. And then just one, I know we're right at time, so I'm just going to give a really quick tidbit of information as someone who has read through some of the applications and then been in some of the interviews. On your application, put all your experiences down. Don't feel like they have to be tied specifically to OT or therapy or phys disability. Like all experiences are good experiences. You learn a lot from having a lot of different roles, whether it's working in retail or being a waitress or again, TAing an exercise or being in an exercise class. I don't know. I've read some really cool, some really cool life experiences, but that is the beauty of OT, right? Like we specifically analyze and work in and try to adapt like real life, real world scenarios, right? So the more like experience you have, like all experience is good experience, I think is what I'm just trying to say. And then in terms of interviews, like again, be honest, be open, and again, like be confident to the best that you can. I understand it's intimidating. It's hard to be in front of people and asking questions and collaborating with others and but know that you can do it and that one, you've made it that far and that clearly you have a passion because you guys are on here tonight and you guys care very deeply. So just know that like your efforts are seen and recognized and we have all been in the same position. So we have a lot of empathy and love to give you guys too while you guys are interviewing. So I hope that that comes through too. It makes it, again, a tiny little bit less scary. Um, but yeah, uh, and yeah, there's some previous alumni sessions in the chat. You can click on that YouTube link. And yeah, thank you all for joining us tonight. Again, we'll follow up with an email about the shadowing hours that you guys have gotten. But thank you guys so much for your participation in our conversation tonight, for being open and flexible and willing to learn about OT and about Rush. And thank you so much, Taylor, Olivia, and Annika, for sharing your experiences too. You guys make the Rush community a stronger and better place. So thank you all tonight. Have a wonderful night.
Hi, everybody. Thank you.
Thank you.
Yep.
Thanks,
Thank you
everyone.
again.
Yeah, of course.